Neonatal encephalopathy is a condition that occurs in newborns and has a number of etiology to it. It's a condition where the baby becomes lethargic, comatose, and the reflexes diminish. So you find a floppy baby breathing well with a normal heart rate, but is sluggish and shows no response like a normal, active, vigorous baby. Now, there are many reasons why neonatal encephalopathy occurs. Like a simple condition like obstructed labor. If the baby's lie is not correct, if the baby's lie is transverse, and the labor has started, but the baby is not moving down with labor, then this is known as obstructed labor. If it is not recognized, and if a C-section is not performed, or the baby is not transferred, where the obstetrician can have a look and decide what is the best mode of delivery, and the baby is not bailed out, then that baby would suffer from hypoxia and then result in a baby who may have neurodevelopmental delay, cerebral palsy, encephalopathy, and so forth. It can be due to any trauma around the perinatal period. It may be due to any metabolic conditions, strokes, or any condition in the mother, such as in utero infections, which then can cause some element of damage or injury to the brain. It could be hypoxia, meaning that the baby did not get enough oxygen going to the brain, resulting in the baby's brain being depressed and the baby being born depressed. It may be due to a metabolic condition that was ongoing in utero and resulted in a baby who was compromised and who had a lethargic, comatose appearance. Therapeutic hypothermia is considered as one of the interventions where the body is actually cooled and then it is brought back to its normal core temperature within 72 hours of birth. It has to be done within the first 6 hours of the injury if the impact is to be of the maximum outcome. So it means that you have to have the baby should be in a place where therapeutic hypothermia can be given, and it has to be within 6 hours of birth. And of course, one has to ensure from a history that the baby has suffered from hypoxic injury, and therefore this baby can be offered therapeutic hypothermia. Unfortunately, these randomized controlled trials have had very different set of outcomes. Now, what do I mean by outcomes? So you're doing an intervention and you want to look what is the outcome of this intervention. Are we looking at deaths being reduced? Are we looking at better neurodevelopmental conditions? Are we looking at better cognitive skills? Or are we looking at just the mortality? Now, the problem at present is that different scientists and different groups of people have taken different outcomes. And we cannot find in any systematic review outcomes which are similar, which can then be compared, and a result can be chalked out, and that result can help us in developing an intervention which would help our patients. So what is happening now is that because we can't compare and the outcomes are not similar, this research is going to waste, because this research cannot be used to help these poor newborns who have already suffered from an injury to the brain. Therefore, this group came about, and we at Aga Khan University were a part of this collaboration. And we looked at what are the potential outcomes that should be included in each study that will happen in future to improve the outcomes of neonatal encephalopathy. And we came up with main 6 such outcomes. The process involved healthcare providers, parents, physicians, nurses, and public health specialists. This group worked together and we interviewed parents whose newborn babies had suffered from hypoxic ischemic encephalopathy or had neonatal encephalopathy, and we asked them what they thought are the various outcomes that should be looked at. We outlined 6 major outcomes that should be looked at. One of them was survival, the other was cognitive, the third was neurodevelopmental delay that should be always be there, and cerebral palsy, which is a condition that is the worst severe form of encephalopathy. And in these, unfortunately, these babies They are sort of dependent. They have significant neurodevelopmental delays, and their lives depend upon the parents looking after them, because they can neither talk, they can neither walk, and it's a very uphill task for these poor babies. Now, what happened is we published this, the cohesion core outcome, and we received some comments. And one of the comments that, as a group, we felt was something that we needed to address was that we were told that these babies had suffered from some element of hypoxia, and the word neonatal encephalopathy is probably not appropriate. We didn't feel that way, because we feel that there's a significant heterogeneity in the etiology of encephalopathy. Some may be pure hypoxia, some may be as a result of other conditions. And since now, at present, we are unable to develop a plausibility, a pathway that we can say that this event led to this event and then subsequent events. And there is so much heterogeneity that we felt that if we were going to label this HIE, we do not have enough evidence to call it hypoxic ischemic encephalopathy. We have not done molecular studies on the placenta. We have not done any genetic testings on the mothers. We have not tested the fetal amniotic fluid. Therefore, it is unfair and probably not right to label this condition as hypoxic ischemic encephalopathy. Rather, the blanket terminology of neonatal encephalopathy suffice, keeping in view the evidence that we have and keeping in view the heterogeneity evolved around the neonatal encephalopathy. So our antenatal care is not really up to the mark in terms of quality also, and also in terms of awareness. That majority of our females, either they don't have access to antenatal care. If they have access, the quality of antenatal care is not adequate, or they're absolutely unaware of the need for antenatal care. And hence, high-risk pregnancies are not recognized early, they're not managed early, and resulting in the fetus being affected. So when a baby is born in such a compromised state, the likelihood of that baby to suffer from hypoxic injury is very high. So another problem in our country is the presence of a skilled birth attendant who can be an obstetrician, who can be a technician, who can be a pediatrician, who can be a neonatologist, but who does know how to resuscitate the baby, what to do if a baby is born compromised. And for that, not only do we need competent healthcare providers, we also need the conducive environment, which includes their certain resuscitation equipment, which should be there, and a certain equipment which keep the baby warm. So all those things are important. So one is the antenatal, the perinatal period, and the period around labor. And because there are a lot of gaps in our systems, as a result of which either the babies they deliver either at home or on the way to the hospital. We recently, in collaboration with University of Ireland, and made a group, and we call this group the Cohesion Group. And the intent of this group was to come up with a core set of outcomes in babies who develop this neonatal encephalopathy. Scientists over the years have tried to come up with interventions to improve the outcome of such babies, irrespective of the underlying condition, be it hypoxia, be it a metabolic disorder. And there have been a number of interventions that have been done in the form of randomized controlled trials, where they've actually looked at interventions and seen whether they work in comparison to the standard of care. And they found that of many of the interventions that have been tried, therapeutic hypothermia, which we call cooling, seems to work the best. Now you would wonder, why did we do this study? I mean, what if it is called neonatal encephalopathy? Why is it called hypoxic encephalopathy? We did this because we realized, when we looked at the literature, that the outcome mentioned were not the same. The intervention was the same. And hence, we did not have enough evidence to actually come up with a recommendation that this is recommended, and if you do this, the likelihood is that the baby will benefit from this intervention. So we felt that we needed to ensure for future studies that these core outcome set should be measured in every scientific trial that is being done on such babies where any intervention is being used, when more data is gathered, and when we do a systemic review or a meta-analysis of all these studies, where we pool the data together and look at it scientifically and see, is there evidence to suggest this works, this doesn't, this works, and this doesn't. What happens then? The research is actually driven for the betterment of the patient. Currently, it's not like that. And therefore, we felt the need that as neonatologists, as scientists, as research specialists, we need to come together and come up in a scientific way with evidence, and then disseminate this evidence to the global academia and to the global researchers. And therefore, we did publish this in one of the high impact journal, Nature. However, the one critique that came about, and it was a very strong critique, was that they wanted us to change the terminology of neonatal encephalopathy to hypoxic ischemic encephalopathy. A lot is now known about sepsis, its pathways, immunomodulations, the systemic inflammatory response. So we know a lot about sepsis now. When you know a lot about a disease, one is able to come up with interventions to improve the outcomes for babies who have sepsis. Both recognition, early treatment, use of antibiotics, and so forth and so on. Similarly, for prematurity, there's been a lot that we now know. There are three major complications of prematurity which lead to death. One of them is respiratory distress syndrome, probably one of the most well-versed and well-investigated entity in premature babies. And we know now that what helps a baby when he or she develops respiratory distress syndrome. However, for neonatal encephalopathy, there is still a lot that we do not know. And as a result of which, and also there is lack of consensus on the definition of hypoxic ischemic encephalopathy, of neonatal encephalopathy. And therefore now, as we speak, there is a group which has been assembled for this particular purpose, who is now looking into and coming up with a consensus on what should be labeled, defined as neonatal encephalopathy. So you're absolutely right, because we know very little and because there's so much to be known. Therefore, it is difficult for scientists to agree on one definition. And because of the huge heterogeneity, there is still a lot of heterogeneity. And until we clarify this heterogeneity and we know exactly what happens in molecular, cellular level, we will come across this controversy.